Good afternoon, ladies and fellow Rotarians. I would like to ask our dashing Vice President and Acting President to call this meeting to order.
By the power vested in me by Mike and of course by Eddie, I call this meeting to order.
Can we ask everybody to stand, please, for the national anthem and for the Rotary hymn? I'm sorry. Sorry. What am I doing? I would like to call Johnny Ang to give the invocation.
Hello. Good morning, everyone. Let us be conscious that God is here and is listening to us. In the name of the Father, and the Son, and the Holy Spirit. Amen. Lord, as we gather in your name, we want to be in your presence. We are thankful for this day that you have given us, for today's blessings, opportunities, and challenges. Grant us a spirit of dialogue, light up our mind with truth, and strengthen our fraternal spirit, that we may always seek and do your will. We thank you for this meeting in which we share our dreams, our projects, and difficulties. Make us always respond efficaciously to your vision and our mission in the world. As Rotarians, we are generally blessed with our lives of relative luxury and opportunities. Open our hearts and resources to those in need while still providing us with appropriate fruits of our own labors. Help us share not only our tangible wealth, but also our intangible riches of knowledge, leadership, and creativity to make our city, our nation, and our world a better place, filled with peace and love that you can bring to us. For those who have contracted COVID, we pray for care and healing and strength, courage, and hope. For those who are particularly vulnerable, especially the elderly and anyone with serious medical condition, and to our dear doctors, medical workers, and frontliners, may they continue to serve, and we pray for their safety and protection. For Father, during this time, may your church be a sign of hope, comfort, and love to all. Grant peace, grant comfort, and grant healing. Be with us, Lord. Amen.
Thank you, Johnny. Please remain standing for the national anthem and the Rotary hymn.
We're the Rotary Club of Makati, and together we stand proud. We are leaders with integrity, always ready to serve humanity, always living by the four-way test, building goodwill and peace along the way, giving hope to the world. to aid our fellow men, as true Rotarians we live to lead. We believe in service above self, and this is why we succeed. We're the Rotary Club of Makati, and together we stand proud. We are leaders with integrity, always ready to serve humanity, always living by the four-way test, building goodwill and peace along the way, giving hope to the world. We're the Rotary Club of Makati, giving hope to the world. The Rotary Club of Makati.
Thank you. Please take your seats. Okay. It's time for our four-way test. Please repeat after me. First of all, is it the truth? Secondly, is it fair to all concerned?
Fair to all concerned.
Will it build goodwill and better friendships?
Build goodwill and better friendship.
And lastly, will it be beneficial to all concerned?
Be beneficial.
Thank you. Now, greetings to our birthday and wedding anniversary celebrants. From the Rotarians, we have Nancy C. on October 7. And Howie's better half, Marla Calleja, on October 10. Happy birthday, ladies. For our wedding anniversaries, we have Butch and Crisel Medalla, and June and Wilma Palafox, both on October 7, and Peter and Jenny Nang on October 8. Happy birthday and happy wedding anniversary to you all. Now I would like to call past District Governor Tony Quila to recognize our Paul Harris Fellows.
Thank you, Eddie. May I ask first David Nichanatan, who will have his fourth Paul Harris Fellow. Howie, can you do the pinning? And he will get a pin with 3 sapphire. And then can I call on past President Eddie Yap to get the pin on behalf of past First and Delhi. Are we?
Congratulations again, David and Andeli. Okay, next, Tony, your duties are not yet over. We have the presentation of our inductees. I will leave it up to Tony.
We have supposed to have 4 inductees this morning. May I call on Andrew Escaler? Andrew is the son of President Michael, sponsored by past President Tito Panlilio, Classification Investment Development. As President Tito, if you can be here as well. Then we have Gaston Pastrano. Gaston here. Okay. Sponsored by Ports Peña, Classification Architectural Engineering. Then we have Nico Sunga. Nico here. Is Nico? Okay, Nico. Nico is sponsored by father-in-law, past President Tito Panlilio. And finally, we have Paulo Turno, sponsored by also by past President Tito Panlilio, Classification Investment Packaging. Now, may I call on PDG Sid Garcia to do the charging.
Hello. First of all, good afternoon to all the new members and to thank all the sponsors, President Michael, past President Tito for bringing in our new members in this club. So I'd like just to, first of all, to thank you for agreeing to be a member of this club. Aside from being the biggest club in our district, it is also one of the biggest clubs in the country. And of course, our club is now on its 56 years of service. Now, I just have one big word for you to keep in mind in this charging session. And what is that word? That word is called engagement. All right. So being a new member, I would like to request all of you to be engaged in this Rotary Club. And so you will know more about Rotary. And that is the only way that you can do it, to really know what Rotary is doing, not only for our communities, but all over the world. I have been a member of this club since 1988. I was sponsored also by past President Tito. And I have really gone through a journey, 360 degrees journey. And it's really enriched my life, enriched the life of my kids, my wife. And we have enjoyed tremendously the warm fellowship of all the members of this club. At the same time, it has given me new meaning on what life is all about. Life is really serving humanity, and in the process, gives you a lot of happiness. So engagement, there are just 7 things that you keep in mind when you talk of engagement. Number 1, attend your club meetings regularly. Our club meets 3 times a week. Can you make it a Rotary Day every Tuesday lunch? Every Tuesday lunch, can I count on each one of you, Mike, Andrew?
Yes. Yes.
Okay, so we expect to see you once a month for lunch, hopefully in Chef Jessie or whatever venue we will be having in the near future. Number 2, engagement. Have you already identified what committee you'd like to belong to?
Environment.
Environment. Who's the chairman of the environment? Is there a chairman we have here? Maybe you can take note of that so you can be invited.
Not yet, but I'll discuss with engineer Park.
Okay, so get involved, join a committee.
Not yet as well.
Okay, so I'd like to request all the committee members, chairman or around here, to please take note. We have 3 members who have not yet engaged themselves. So maybe they can be part of the committee. Our club has more than 50 committees. So it's good for you to be engaged. Okay. The other thing is you need to socialize. Of course, all of us prefer to stay in a couple of tables where we are familiar with some friends. In fact, many decades ago, I remember we have a club. In our club, we have a table called number 13. These members, they just stick together for so many years. That is what we don't want you to do. We want you to keep moving in different clubs so you get to know them, the new members, and you get new friendship, and you really get to know more about each other. Fourth is accept leadership. All of you have been in different fields of business, and now you're all captains, more or less, of your companies or in a senior leadership position. Please get involved. If you've been asked to be a committee chairman or a committee member, do not say no. In Rotary, we never say no. I remember when I first joined Rotary in 1988, I was asked by past President Fidel to join a committee, and he made me the chairman. And what was that committee? It was a very simple committee. It's all about beautifying our elementary school. And I told them, okay, I will join on condition you'll be a member of my club. At that time, our president was the late June, the late presidency, June Rojas. No, so it's really important for you to be involved, to accept whatever committee is requested of you. I also got involved in the Interact. I did not know anything about it, but it was good. I had a chance to really integrate and learn how to take care of young people. No? So really, you need to join a committee, accept a responsibility, and really get involved. Of course, another important aspect of being a new member is to pay your dues regularly. So what are the dues? Club dues, district dues. We have the Rotary International dues. And of course, we also have the subscription to the Philippine Rotary magazine. These are all required of you to keep the club, the district, and Rotary International moving, to pay your dues regularly. Now, another important aspect in engagement as a new member is to bring a new Rotarian, bring a potential member in the club. This is important because we need to share what Rotary can do to help others. We need to share this gift that has been bestowed upon you by becoming a new member of this club. So share Rotary by bringing in a new member. And of course, bear in mind that we are here on a mission. It's not just fellowship, it is also service. And the mission of Rotary is what? To bring goodwill, understanding, and peace, and to do humanitarian projects. So we hope that you will really get involved and be engaged so that we can have a more, you can really enjoy fellowship with one another in this Rotary Club. President Howie, they're ready to be inducted now.
Thank you, Governor Sid. And to our new members, may I request all other fellow Rotarians to stand up as we witness and welcome our 4 new members. Okay, please repeat after me. I state your name. After being sworn in as a member of the Rotary Club of Makati, do solemnly swear that I will abide by, follow and uphold all the provisions of the Constitution and bylaws of Rotary International, as well of those of my Rotary Club, and fulfill to the best of my ability all the duties and responsibilities of my membership. I pledge to advance the object of Rotary and to exemplify Rotary's maxim service above self. I further swear to promote awareness of the theme of Rotary International 2022-2023. Imagine Rotary, and of the duties and responsibilities that go with it. All this, I pledge freely and voluntarily, without any mental reservation or purpose of evasion. So help me God. Okay, congratulations.
Can you give the, can I ask Philip Sullivan to put apron on Gaston since Force is not here? And can I ask Past President Louis Ashoche to put the apron on Neil Makashar since he has not gotten his apron? Neil?
Dito. Wala tayong pen.
That's why I asked him, sabi ko that's unusual. Don't want to take that. Today ko pala, congratulations niyo.
Sit. Okay, let's give our new members a round of applause again. Welcome, welcome. We are happy to have you. All right, moving on, we'd like to acknowledge our guests and visiting Rotarians. Some of them are here physically, but obviously some are online. So among our dignitaries, past District Governor Tony Quila, past District Governor Sid Garcia, and past District Governor Pepito Bengson. And our aunts, Nelly Bengson, Marisa de Rosario, Yvonne Kwan, and our speaker's better half, Maida Prieto, online. And our guest, Carlos Garcia, who's the guest of past President Charlie Rufino. And additional guests, Brian Prieto, Sandy Romualdez, mukhang family affair, Andrew. Anne-Marie Rivera, Marixie Prieto, Celi Abao, Andrew Tarvis, Charito Aguilar, and Jeremy Castillo, all online from the company Sanvar Group of Companies and Marilex Realty. And also Karen Garcia, Audrey Prieto, Linda Pelonia, Sharon Gersava, Oliver, there's no family name, Aida Garcia, Charito, Feli Monteroso, and Jonah Razel Alquiza. Welcome, everybody. Welcome. Okay, now I'd like to call Neil John Macasiar, okay, to give us his classification talk. Let's give him a big hand.
Okay. So, I'll just hold the mic. It's easier. So, protocol observed. Good afternoon, ladies and gentlemen, here and in Zoom. Good afternoon. I am Neil John Makashar. You can call me Neil. I was born and raised in Zamboanga City. And like most of you, I also come from the better school. So depending on which side you're on. So fortunately for me, I had the best of both. From kinder to high school, I went to the Ateneo de Zamboanga University. And for my tertiary education, when I saw the green light, I went to De La Salle University in Manila. So I am a second generation Rotarian. My father is a past district governor of District 3850, covering Western Visayas, the islands of Panay and Negros, Western Mindanao, covering the Zamboanga Peninsula, all the way to Basilan and the farthest south of the Philippines, Tawi-Tawi. So I am the eldest of 3 boys and happily married to Camille, my Anne, with 2 sons. Lance, a 5-year-old boy who had his first day of face-to-face classes yesterday. So thank God. And Mateo, our baby boy who turned 5 months old last week. I was lent the classification of manpower management. So we own a manpower company catering to businesses across different industries here in the Philippines, and a staff leasing company catering to foreign clients. We are also into real estate, distribution, fashion, retail, financing, education, among others. I spend most of my time managing our manpower company while my wife does everything else. So coming from the province and not joining the family business, we started with 0 clients, not knowing anyone here except my classmates in La Salle, whose parents were our first clients. And from then, we have slowly grown, expanding our footprint into every key city nationwide. So we have deployed thousands of people. And during the course of doing our business, as we were growing, and in our efforts to make a difference and be men for others, integrating what we were taught in school into our daily lives, into our businesses, we ran livelihood programs for our people, all for free, all with certificates, with TESA certificates. We did manicure, pedicure, chocolate making, candy making, whatever we can think of for our people, for their livelihood. And we did this only when we thought about it and only when we had the time. During one of our brainstorming activities, my wife and I were discussing, and we both agreed that we wanted to do something more sustainable and more impactful for the lives of our people. So we decided to put up a school for the dependents of our people. So we realized that the average Filipino family size is about 5 to 6 with only 1 breadwinner, which means that 4 to 5 people only depend on that 1 breadwinner. And it's very likely that that 1 breadwinner is our employee. So we put up a school for their dependents, and we have heard so much testimonials from the graduates of our school. So even at the core of our business, while we are already giving jobs, we dedicate ourselves to service. So there's a saying that goes, no joy can equal the joy of serving others. I'd like to share with you my Rotary story, my story. My Rotary journey began over 20 years ago when I was first exposed to Rotary as a Rota kid. Back then, we were transitioning from mankind is our business to sow the seeds of love. So I still remember. Rotary, as we know it today, was totally different. Different in a sense that it felt that it was just about to boom. Just some trivia for those who are unaware. The logo was different. Global grants were called matching grants. Donations to the foundation were not as substantial. In the past, when districts would have 20, 30, 40, 50,000 donations to the foundation in a year, masaya na yung governor. But ngayon, I think that is just our club's donation to the End Polio Fund, I think. There was a classification limit per club. Attendance was required, otherwise you will be dropped. The Paul Harris pins, which we received earlier, came with a medallion. So, and the list goes on. It's different. I saw all of these. And with my parents being very active, I learned a lot about Rotary, about the Rotary way. I was always the designated driver whenever dignitaries or PDGs would visit Zamboanga City. Today, Rotary has officialized this role in major Rotary activities as aid. We also attended all district conference, be it in Iloilo, Bacolod, Boracay, or Zamboanga. And over the course of my childhood, we have been host to several GSE team leaders. So GSE means Group Study Exchange team leaders from India, from Korea, from Brazil, from the US. All of them lived with us. And 2 Rotec scholars from France on different years. So who up to today we consider our sisters. So I grew up very Rotarized. All members of our family are Paul Harris Fellows, and my sons, even before they were born, as soon as we had their names, were made Paul Harris Fellows. So Rotary affairs became family affairs, and our family of 5 grew exponentially because of Rotary. That is the kind of influence Rotary had on this young boy. Imagine. I eventually became the youngest Rotarian of the Rotary Club of Zamboanga City West, District 3850, one of only 2 all-male clubs in the district today. And like RC Makati, a consistent outstanding or most outstanding club in the district at the young age of 23 years old. So that was 10 years ago. The previous record of that club was 24 years old, set in 1989, the year I was born by my father. So it stood for 23 years until I broke it. I stayed with the club for 3 years, even serving as the club's public image director in the Rotary year 2013, 2014, the year our districts 3830 and 3850 had a joint discon in Boracay at the time of PDG Robert Kwan, before finally resigning as I stayed in Manila more than Zamboanga. I had no intention of joining Rotary at this time, as I do not have the luxury of time even just to play golf, because I want to be at home most of the time enjoying my kids while having to balance managing our businesses and being an active member of Freemasonry. Coming from another district, from another outstanding all-male club, and my mother-in-law, P.P. Lewis' classmate, president, coming from another club in this district, and now with me here, I think this is providential. As I close, allow me to thank my sponsor into the Rotary Club of Makati, Attorney Louis Aseoche, our district's most outstanding president. Like what our national hero, Dr. Jose Rizal, said, who, by the way, arguably would have been a Lasallian if LaSalle existed back then, said, and I quote, "He who does not know how to look back at where he came from will never get to his destination." End of quote. So thank you very much, PP Louie. In my language, we say muchas gracias a todos for your warm welcome. So to PDG Sid, thank you very much. PDG Sid was with my father when they were together as directors of the Philippine College of Rotary Governors. PDG Tony Kila, all the members of RC Makati, to the Secretariat led by Ron, Ria, Richard, and Angie, and all the members I have encountered, thank you very much. I look forward to meeting and engaging more members of RC Makati during our regular meetings, or better yet, during fellowship. So again, thank you very much.
Thank you, Neil. Thank you for sharing. Okay, now I'd like to call Vice President Howie Calleja to give the President's time.
Good afternoon, fellow Rotarians. Again, in behalf of our President Michael, who is in London having tea with the King, allow me to have this little time to discuss the previous agenda or previous activities and the activities to come in the next week. Last September 28, our club sponsored a breast and cervical cancer screening with 100 residents from Barangay Concepcion in Malabon, together with RC Premier, the Philippine Cancer Society. Of course, thank you, PP Cesar Campos. Let's give him a good hand. And of course, Director Andrew, who's our speaker today. Director Dr. Andrew. Thank you. Let's give them a vote. Please be reminded, this is our 4th medical mission or cancer mission of this kind for this Rotary year, and we have lined up several more. So please join these projects or these upcoming projects for this cancer screening. Thank you also for our mini socials conducted by PP Roland and Ann Kaling for hosting mini socials RCM North Group last September 23 at ZU Restaurant. Sino bang nasa North Group? Please raise your hand, yung mga sumama dun sa fellowship na yan. Oh. Shoe. Kasi hindi ako nakadating kaya I lost my shoe. Kayo tama, walang tumatawa sa akin ngayon. Yung walang finding moment kasi si Tito si Pipi Tito, kaya walang napapatawa ngayon So we hope that more and more of our members will join these mini socials and volunteer to hold these mini socials. So thank you again for from PP Roland and Ann Kaling. Congratulations again to IPP Louie for receiving the membership award of Rotary Zone 10A for being the biggest club in the zone for year 2021-2022. Oh, let's give PP Louie a big hand. Diba? Ilan weeks na to, PP Louie, that you have been getting awards left and right. So I think you should libre, or inaantay ka na daw ng district. Ayan, The district governor is already patting you on the back as the next district officer. And then soon to be governor. Ayan pala naman. Parang hindi masaya. Again, soon to be governor. Yay! Okay, congratulations also to PDG Peps. And for receiving the first prize for successfully organizing the most number of Rotary clubs. So congratulations, PDG Peps. Congratulations also to Gani Benaflor for bagging the first runner-up in the advanced category of the 9mm Shoot Fest at Camp Bagong Diwa. So yung ating mga shooters and sharpshooters, we can join them in the shooting or the Top Gun in our RC Max shooters continue their winning streak. Okay? For our relief mission in Typhoon Carding, although we were fortunate that the typhoon did not hit Metro Manila, RCM disaster response was on their way to deliver the much needed support for the typhoon victims. Tomorrow, on 5 October, we will deliver 500 food packs for 500 families in Dingalan, Aurora. Also on Saturday, partnered with RC Muntinlupa East and the relief mission of AN Nueva Ecija, we will donate 30,000 to cover purchase of GI roofing sheets distributed to the families of AN Nueva Ecija. I would like to thank Director Boom, who's the head of the disaster committee. Director Boom, congratulations and thank you. And to our new members who have not joined yet, maybe a good committee also is the disaster committee, relief committee by Director Boom. Maybe Director Boom, you can invite our new members to join and bring them to your disaster missions. No? Also, Director Drex and Director Chris, thank you for your timely action. So let's give a round of applause to Director Boom, Director Drex, and Director Chris. Also, thank you to PP Tito for donating 100 cases of Bali Pure bottled water, and for Taba Samson for 200 pairs of slippers. And I also would like to again thank Rotarian Winston Uy for providing the truck and the transportation to bring all of these goods. So let's give them a round of applause. Thank you. Finally, thank you to our brother club, RC Cebu, for donating 100,000 in support of our relief mission in Typhoon Carding. So thank you, RC Cebu. And I would just like to maybe announce for next week, it would be a ladies' day. So please invite your aunts in our meeting next Tuesday, also here at Chef Jessie at 12 o'clock. Our speaker would be Congressman Joey Salceda from the 2nd District of Albay. So let's have a good attendance for next Tuesday, again online and here face-to-face. So please, we'll be expecting your ladies. To the new Rotarians, if you're not yet married, you are free to bring whoever lady you desire. So thank you and good afternoon to everybody.
Thank you, Vice President Howie. Now I'd like to call past President Bimbo Mills to introduce our distinguished guest, one of our own.
Thank you, Ed. Members of Rotary Club of Makati present and the guys on the Zoom and guests. We're fortunate today to have a guy with a very big heart who also takes care of hearts. And I understand is the heartthrob of many of the nurses in all the hospitals he works in. So he's really a heart guy, okay? All the way in every aspect of it. Okay. Serious now, Andrew Prieto specializes in interventional cardiology. Okay, I'm not going to say additional intervention issues that he practices into. Okay, he works his craft at Makati Med, at St. Luke's BGC, at Asian Hospital in Alabang, Medical City, the Diliman Doctors Hospital, and in Guam. I wonder why Guam. Okay, but anyway, he does. He's a graduate of the University of Santo Tomas and did his residency and fellowship at the Michigan State University Hospital. He also sharing his knowledge via teaching medicine as an associate professor in the University of Michigan State. He was awarded for his teaching skills an excellence award at the University of the Division of Cardiology of Michigan State. He's now a fellow at the Philippine College of Physicians and the Heart Association of the Philippines. He's here today to tell us in a very specific way what we really need to know about blood pressure, hypertension, and a host of other diseases that he can prevent or he has prevented. And he will tell us about what we should avoid as well as what we need to do finally to make sure that we don't get to visit him. Okay. He, as a way to have a safer testing area, he organized Reliance Heart and Vascular Institute, which conducts all kinds of cardiac diagnostic tests, non-invasive imaging tests, and outpatient lab procedures, so that you can do that outside the hospital confine and be safer from COVID and all of these other things. No? So today, we'd like to now take this chance to welcome him to our club as a speaker, aside from being a member. As you know, he was the leader. He truly is a big-hearted guy because he's the leader of all of our medical missions, numerous missions annually, and he never stops helping up on that area. Andrew, please, the floor is yours. Thank you.
Thank you, Bimbo, and thank you all for coming. Real pleasure. And also welcome everyone online. I think some of the people online are my family members, and I think they attended already the Rotary meeting, so some of them want to join na yata. But yeah, one of the reasons why I accepted to give this talk is one, to introduce myself as a cardiologist. Some of you don't even know I'm a cardiologist. And also to tell you about what my passion is, which is heart disease. No, February is the month for heart awareness, but I think in the middle of the year we need to also know about heart disease, no, or more specifically, coronary artery disease. This is the arteries that surround the heart and provide oxygen to the heart muscle. And this is the #1 cause of death in the Philippines. We just had a somber reminder of this. One of our staff members passed away from heart disease. So it's very common. And the other important fact is 90% of heart disease is due to one or more modifiable risk factors. So I think it's very preventable. And we just have to know these risk factors, and we'll be able to prevent heart disease. So what we have some slides here now. What we need to know. Well, first of all, the heart is in the middle of our body. Okay, it's a little bit of anatomy here. It pumps blood to the brain, and then the arms on both sides, the limbs, and then the internal organs, and then the legs. Arteries are the vessels that deliver blood to the organs and the limbs and the brain, and then the veins are the ones that return it back to the heart. So the heart's role is to circulate all this blood. It pumps blood to all the different organs. Next. So what's in the blood? What's so important? In the blood, we have gas exchange. We have oxygen that goes to the heart, to the muscles and the organs. And then carbon dioxide is the waste product of energy metabolism, and that is taken away by the veins and brought to the lungs for gas exchange. And then it also has nutrients. It has removal of toxins. It contains clotting factors to stop bleeding, and has immune cells to fight infection, like COVID. Okay, now one of the important risk factors that I mentioned to prevent heart disease is the blood pressure. This is the force of your blood pushing against the wall of your arteries. And the systolic blood pressure is the top number. And this measures the pressure when the heart muscle contracts. while the diastolic blood pressure is the bottom number. And this measures the pressure when the heart muscle is resting and filling up with blood. And the normal blood pressure is less than 120/80. Borderline is 120 to 139 over 80 to 89. And hypertension is defined as a blood pressure greater than equal to 140/90. The Philippine Society of Hypertension defines high blood pressure as an office blood pressure of 140/90 or above. And this needs to be at least twice taken on 2 separate days. Out-of-office blood pressure measurements are recommended to confirm the diagnosis of hypertension, because usually in the clinic, the blood pressure is sometimes higher than it is at home. So most of you don't live, you don't live in the clinic, so this is a good thing, no? But so that's why you need to get your blood pressure out of the office. The preferred method of measurement is the ambulatory blood pressure monitoring. This is an automated, it's there on the diagram or the picture there. But an alternative method is just home blood pressure monitoring. Now, what are the symptoms of hypertension and complications? You have fatigue, severe headache, vision problems, difficulty breathing, chest pain, pounding of the chest, neck, or ears, we call that palpitations, blood in the urine, and an irregular heartbeat. But for most patients with hypertension, you do not have any symptoms at all. Okay, that's why it's called the silent killer. So it's important to have your blood pressure checked regularly. So you can't rely on symptoms. Now, 90 to 95% of hypertension is what we call primary hypertension. This is elevated blood pressure brought about by genetic and behavioral factors. So it's not secondary to anything. Otherwise, you have secondary hypertension, which is elevated blood pressure secondary to another medical condition. Other risk factors are non-modifiable factors such as age, genetics, ethnicity, and sex, while modifiable factors include body weight, salt intake, smoking, and exercise. Other risk factors include smoking, being overweight or obese, lack of physical activity, too much salt in the diet, too much alcohol consumption, which is usually more than 1 to 2 drinks per day. So nobody here. More risk factors. These are less traditional. Stress, which is very hard to quantify. Older age, genetics, which is a family history. Chronic kidney disease, adrenal and thyroid disorders. Now, people who are more likely to develop hypertension are people with family members who have high blood pressure, people who smoke, African Americans, women who are pregnant, and women who take birth control pills. Now, other people who are more likely to develop hypertension are people over the age of 35, people who are overweight or obese, people who are not active, people who drink alcohol excessively, and people who eat too much food rich in fat and in salt. So how do we prevent this? One of the sad, I guess, facts is that the Philippines is one of the worst in Southeast Asia as far as heart disease is concerned. This was from actually an article from Inquirer showing that in Southeast Asia in 2019, the Philippines was one of the worst in as far as heart disease prevention is concerned. So being a cardiologist, I really hope that I could change this. Oh, okay, it's different here. So what are the complications of related to hypertension and heart disease? Stroke. Stroke is like a heart attack of the brain. Okay. We have their sexual dysfunction. That's also a complication of heart disease. So hopefully that will get your attention. And then kidney disease. Kidney disease is also a complication of heart disease and high blood pressure. And also, diabetes, by the way.
Kidney disease.
Okay. Okay, so anyway, all of these, I don't really have time to, expound on, but heart attack is probably the most important. This is the reason why people usually pass away from or expire from heart disease, and this is from blocked arteries. And the reason for this is those risk factors that I mentioned, which I'll talk more about later. Stroke is the same thing, but blocked artery supplying the brain. Next. By the way, chronic kidney disease, obviously when you have really bad kidneys, eventually you'll need dialysis. And this is like they're complementary. Dialysis will cause more heart disease, while heart disease will also cause more kidney failure. So we work very closely with the nephrologist. Yeah. Vision loss, the blood supply to the retina is also obviously coming from the heart. So this can also cause vision loss if there's a blockage. Same also to the pelvic area, the genitals, you could have blocked arteries there. So what do we need to do? Management of heart disease includes regular checkups with your doctor, taking maintenance medications. These maintenance medications, they're not perfect, no? But if you can control your blood pressure with a maintenance medication, then it will ease your organs from the high blood pressure, the heart, the kidneys, the brain. It does not handle high blood pressure very well. So you need to relax the blood pressure to keep your organs intact and to improve the longevity of your organs. Lifestyle changes are important. Diet. Okay, diet, I think I'll explain more later, but if you're gonna follow a diet, I think the Mediterranean diet is the perfect diet. This is where people live the longest, and it's a little complicated to talk about it in one session, but if you can Google the Mediterranean diet, which is less processed foods, more plant-based meals, and even whole grain is okay. Fish and chicken for protein. That is the best diet. Even a little wine and eating with friends and family. This is all part of the Mediterranean diet. Exercise. We'll talk about that more a little later. But aerobic exercise and also some resistance exercise is also important. weight loss, avoid alcohol. A little alcohol is okay in moderation, but not excessive. Stop smoking and adequate sleep and rest. That's the new latest important factor, is to have good night's sleep. I think it's important also to have your electronics away from you when you're sleeping, so you will have an uninterrupted sleep. Next. So we talked about the Mediterranean diet, but there's also other things to think about: low salt, low fat, low cholesterol, low sugar. So not a very rich diet. Huh? Optimum levels of vitamins and minerals. This is another diet called the DASH diet. This is, on the other hand, less sodium. Yeah. But then it also follows the Mediterranean diet. As you can see, fruits, vegetables, whole grain, healthy dairy. This is also nuts. Nuts is okay, seeds and legumes. These are all part of a Mediterranean diet, actually. Okay, low fat and fat-free products. Red sauce instead of white sauce. Baked, boiled, steamed instead of fried, and fish instead of pork. Water instead of sugary drinks and sodas. This is if you can just do that, that's already a big, it has a large effect, avoiding sugary drinks. Fiber, this is in a lot of fruits and vegetables and whole grain, even oatmeal. Be physically active, like I said, 150 minutes per week of moderate intensity exercise. Or if you want to count steps, 10,000 steps a day is also another ideal goal. Some resistance training, though, is also good. This has also been shown to decrease cardiovascular, improve cardiovascular health. And it doesn't have to be 150 minutes. It's just 1 hour a week of resistance exercise. Weight loss, we try to achieve the ideal body weight. We follow the BMI, or the body mass index, which is getting your height and weight, and you want to achieve 25 to 29 BMI. Not only the BMI is important, but also your waist to hip ratio. So try to decrease the size of your waist. I think it's very important. Don't smoke. That's pretty obvious nowadays. There's many ways to try to quit. I don't know if it's here, but just set a date to quit, and you can usually stop cold turkey on that quit date with some nicotine patches, nicotine replacement. Check your blood pressure. We mentioned that already. Limit your alcohol intake to 1 to 2 drinks per day. Yeah, and then maintenance medications for your blood pressure, for your cholesterol, for your diabetes, and also for heart failure. There's also medications for blood pressure. So, like I said, there's no cure for hypertension. Okay, high blood pressure is you can only maintain a normal blood pressure with medication. So you have to take maintenance medications pretty much lifelong, no? Even for diabetes. But you can try to do what you can with your lifestyle. But if that does not work, then I would recommend that you take your medications religiously. Went to see a cardiologist for hypertension or pre-hypertension, diabetes. Although we do have an endocrinologist for your diabetes, but we cardiologists know some basic treatment of diabetes. If not, he can refer you to an endocrinologist to treat your elevated blood cholesterol, your elevated uric acid, if you have an abnormal ECG, anybody age 40 and above, anybody who's obese or have a strong family history of heart disease should see a cardiologist. Okay, so in conclusion, hypertension and heart disease is highly preventable in most cases. Lifestyle changes and medications prescribed by the doctor are important to avoid complications. Talk to your doctor, get regular checkups, and get support from family and friends. Yeah, so I'm opening the floor for questions.
Thank you, Andrew. Yeah, we're open for questions. Yes, sir. Tony Boy.
Hello, Doc Andrew.
Hello.
We seek your good counsel. For members of the club who underwent or will undergo a angioplasty or heart bypass, how soon after the heart procedure can they engage in sex? And how many rounds?
Putting me on the spot here. Sexual activity is a very low risk.
Low risk.
Yeah, it's a low.
That's
It's
good news.
yeah. You don't need too much energy, okay, to perform, as long as it's with your wife. But getting aside, yeah, usually just a few weeks after angioplasty.
A few weeks, huh?
Yeah, or even
Okay.
just a month
Guys,
after
you heard that,
bypass.
Carlo? Is it safe to take Viagra? Viagra, tindog
If you
Tacloban.
don't have if you're safe to, like, if you're, for example, you don't have a condition that is going to cause you to go to the emergency room, like angina, chest pain, then it's safe to take
Okay,
Viagra.
that's good news, Carlo.
There is a lot of conversation about people need to get so many hours of sleep a night. Unfortunately, after my attack with COVID, my insomnia became so bad. And I can't have maybe at the most 2 to 3 hours of sleep. I've consulted my psychiatrist and other doctors. They do not want to give me Ambien or Stilnox because my memory will be affected. So what can I do to get some Z's?
Yeah. Well,
I
wakes-
tried Benadryl.
Yeah.
It helps, but it's only good for 2 hours.
what wakes you up?
What wakes me up? I don't know. I have no anxiety. My mind is blank. I just wake up. I can fall asleep easily. I can fall asleep at 8:30. I can fall asleep at 10:30. But I still wake up.
Do you sleep during the day?
No, I wish I could, but I'm always sleepy.
Yeah.
I'm always sleepy.
Okay.
During the day, I wish I could get that feeling at 2 o'clock in the morning.
Mm.
But at 2 o'clock in the morning, my eyes are really wide awake.
How about caffeinated
I
beverages?
stopped coffee.
Mm.
I stopped drinking Coke.
Sometimes,
Yes, I have a CPAP machine.
there was CPAP.
I have a CPAP.
Mm.
I was supposed to see you, but COVID prevented me.
That can be a complicated problem, but sometimes still Nox or Ambien is actually safe naman. It's not even a narcotic, so maybe it can start your cycle. It won't. I don't think it affects the memory. Anyway, yeah, but sleep is very important, and there's a lot of things that we can do to improve our sleep, like making sure you sleep at the same time. Don't exercise before sleeping. Yeah. Yeah. I think we have some questions from the audience. Let's check.
Before we read the question online, any other questions? Okay, Governor Sid, please, EDG.
Hi, Andrew.
I said,
Welcome back to Manila.
favorite patient.
And thank you for all the good you do for our club, all those medical missions.
Welcome.
Yeah, I have two questions for seniors. When I say senior, 70 towards 80, what would be the ideal range of blood pressure that we should try to be in that level? Secondly, is what is the relation of high uric acid to your heart condition?
Okay, good question. Blood pressure in elderly, we try not to be as aggressive because you're more, when you get elderly, you're more prone to dizziness and falling. So we usually check if your blood pressure is high in the systolic and diastolic, then you want it to be less than 140/90. But if it's an isolated systolic blood pressure, because a lot of elderly people, their systolic is high, but the diastolic is actually low. And so our target is just less than 155 for the, well, definitely has to be below 90, yeah. Yeah. Sorry, and then the other question you had was uric acid. Uric acid, that's no direct effect on heart disease, but the same things that increase the uric acid can also cause heart disease. So just rich food, a lot of sugar, a lot of fat will increase the uric acid. So it's like a marker, but it does not have a direct effect. Like there's this study also that said that people with bad teeth have heart disease, but I don't think it's a direct relationship. I think it's because of the food that causes that.
Yeah, Past President Louis.
Actually, Vice President Howick requested me to ask this question because he could not understand the paradox. How come consistently elevated blood pressure leads to loss of virility when you're supposed to be pumping blood, according to him? So what accounts for it?
Yeah, well, it's like a rubber band, no? I mean, if you stretch it for too much, nawawala yung ano niya, it becomes stiff. Nawawala, not stiff in the way you want it, but nawawala yung ano niya, elasticity. So when called into action, parang it gets too much stimuli. No, it doesn't work the way it's supposed to. Well, We can talk about that privately.
Okay, there are questions online. I'll read it. Are there tests for blockages already available during executive checkups?
Okay, that's another good question from PP Reggie. Yeah, the best test now that we have that's non-invasive to rule out blocked arteries is what we call a CT angiogram. Yeah, it's totally non-invasive, except they give you dye, so you have to check if your kidneys are working. And then, yeah, it will give you that information if you want to know without doing a traditional angiogram. Kasi the stress test, which is what we usually order to rule out blocked arteries, they're okay, but the blockage has to be severe before the stress test becomes positive. At least more than 50%. So if you really want to know, some people naman kasi they don't also want to know if they have a 20% blockage. But if you want to know if you have any blockages at all, a CT angiogram.
PP Charlie.
Andrew, you know, I went to visit you when you were in California, and I remember you said, Tito Charlie, come and see me. I'm completely free today. And by the time you picked me up, you had 3 stent operations. So between stent and bypass, what are the advantages? Because some people ask me, should I have a stent? Should I have a bypass? I know you're very good in stents because you're the teaching stent. But what's the difference between the two?
Okay, very good question. There's a role for stents and there's a role for bypass. A stent can only take care of 1 or 2 blockages, especially if they're very focal. While if you have a lot of blockages, then you might need a bypass. But there's also a gray zone between the two. Sometimes if there's a confusion, we will ask both the surgeon and the interventional cardiologist to kind of discuss the case. I always, when I do the angiogram and I find blockages, I always try to put myself on the side of the patient and say, what would I do? Or if, if he was your father, what would you do? Because it's really, there's a role for both. It's a little complicated also to go over that the whole scenario, but there's a role for both, and usually if it's simple, it's angioplasty. If it's complicated, then it's bypass.
Hi, Andrew. Question on our wearables, right? So our Apple Watch, while it says it does not predict heart attack, how accurate is this? And then is there a chance that I heard new medical devices will be able to check our blood pressure? How will it do that? With air, or will it have a laser or something?
Yeah, yeah. Those wearables they're very important, mainly for rhythm. I think fast rhythm, slow rhythm, or irregular rhythm. But to tell if you're having a heart attack, maybe not so reliable. Yeah, there's a way to check your blood pressure now without cuffless. Yeah, and it's actually approved in they have what we call a CE mark or approval in Europe, and it's seeking FDA approval in the States. I think it's like a fiber optic type, that's how it works. So yeah, that's the up and coming, and it's pretty accurate, I heard. Yeah, you just have to calibrate it though.
Yeah, Doc Andrew,
Yes, sir.
can you talk about the myocarditis and pericarditis that have come out, which are linked to the vaccine, and whether people have taken the vaccine, even if they have not experienced it immediately after or shortly after, will they is there any fear that they might get it down the road? Thank you.
Yeah, not likely if you don't get it immediately. This is like a offshoot of actually the real myocarditis that happens with the real COVID, no, not just the vaccination, but the virus attacks the heart just like it attacks the lungs and other organs, and it causes inflammation. And so that's what we call myocarditis. Most of the myocarditis, though, is benign. No, it doesn't. It's not a prolonged episode, and usually just chest pain, not really heart failure, which is what we are afraid of. But the way to diagnose myocarditis is by MRI, is the most sensitive way now. But the myocarditis that I've heard from vaccine are usually young men, boys actually, and usually it's chest pain, and then usually within 4 to 6 weeks it resolves. So I've not heard naman that myocarditis is something associated with like long COVID na it's chronic. Yeah. But never say never, you know, there could be, but it's rare.
I'll read another question. Tito, you have a question? Okay, just real quick, no, online. Dr. Andrew, what's your take on the keto diet and intermittent fasting?
Okay. Well, I mentioned the Mediterranean diet because wala naman bawal, no, sa Mediterranean diet. Now, keto diet is really trying to take away one whole segment of the food group, one whole food group, which is carbs, which I think we need a little carbs, you know, some carbs in our body, and the problem with the keto diet is a lot of times you're losing weight, but you're not monitoring your cholesterol, and a lot of times the fat found in the keto diet increases your bad cholesterol. So if you're monitoring your bad cholesterol and you're actually losing weight, then it's possible to go on that. Intermittent fasting is probably a little more safer for as far as the heart's concerned. Yeah, but the keto diet, I've seen some people where they're not monitoring their cholesterol, and then they come kind of 6 months later, and there's already some harm done. So that's my only recommendation is if you're gonna go on that, because it is effective for some, is to monitor your cholesterol.
Tito?
Okay.
Two questions, Doc.
Tito.
Well, the first is, I don't know if it's akin to what PP Junjun asked. I've heard it often said that if you get COVID and you recover from COVID, it could also lead to a heart attack when you're already negative. And doctors say that after 2 to 3 months of COVID, you get a heart attack. COVID has something to do with that. True or false?
Well, it could partly be true because during influenza, which is also another, which is related to COVID, there's an increased heightened, risk of getting heart attack. Maybe because it increases the inflammation, metabolism in the body. Maybe you stop taking some medications. It's a little complicated, but and then at the same time, COVID increases your clotting mechanism. So a lot of times we're treating COVID now with blood thinners. So for all those reasons, there's probably a heightened risk for heart attacks during COVID or during the time. So you have to be careful with your blood pressure, your blood sugar, and your cholesterol during these times. Now, if it's all controlled naman, I think it's less likely.
Okay, thank you. So for the second question, we just lost John, our John Palmiano. supposedly very healthy, goes biking every week. Then suddenly, while biking, he collapses, suffers a heart attack. How do you explain such paradox?
Yeah. More often than not, we don't know. I don't know John's case too well, no, but we don't know a lot of things that we're harboring, during this time, because maybe he's relatively young. He thought that he was, totally fit and fine, but maybe we don't know that he actually has, for example, familial hypercholesterolemia, wherein his cholesterol is actually high. But if you don't check, you won't know. High blood pressure is another one, blood sugar. So I'm not really sure what he has, but usually one of those things are present when somebody has a heart attack.
So, Doc, so is it very important then that before we exert ourselves, in some form of exercise, biking, well, I don't know if golf is really that taxing, but let's say biking, or just going to the gym, which sort of pushes you, you suggest that you go first for a physical examination, right?
Yeah, I think it's prudent, make sure that all your risk factors are controlled, and then maybe do a stress test where you actually, in a controlled setting, push yourself, and you'll be able to see if you have any occult blockages that you don't know of. If you want, you can do a CT angiogram even, but a stress test is probably more what we call physiologic, no? Parang it's more simulating what you're going to do. So I think I would recommend that, and that's in all the wellness visits that you do these days. They always include a stress test anyway. So I think it's a prudent to do that before embarking on something that you haven't done before.
Okay, thank you.
Anybody else? Any other? One last here online is drinking warm water every morning, does it help lower blood pressure?
I haven't really heard about that, but interestingly, tea, like black tea and even coffee, in moderation has been shown to increase or decrease, improve cardiovascular health. So that's just come out recently. So if you're a tea drinker or coffee drinker, you don't have to stop. And of course, warm water is probably also healthy, more for digestion. And if it makes you feel better, it could lower your blood pressure as well, because a lot of blood pressure is stressing.
Okay.
Before I stop, Karen Garcia is our manager for marketing for my organization, the Reliance Heart and Vascular Institute. Can she just say a few words?
Sure.
Thank you. I only have a few slides, sir. And good afternoon. I'm Karen. So I belong, just like Doc Andrew, we are part of a cardiovascular clinic that opened just last year. It's called Reliance Heart. And so if you want to see more of Doc Andrew and talk to him about blood pressure, come to our clinic. So we just opened last year, and actually our parent company is Unilab. So funded by Unilab, a part owned by Unilab. We are a subsidiary of Unilab. And who we are a clinic that specializes in cardiac diagnostic tests, just like the treadmill stress test that Doc Andrew was mentioning for checkups, non-invasive imaging tests, and outpatient cath lab procedures like the angiogram. And what we do is we have angiogram. Depending on your condition, we can do it outpatient. We've had patients that come in 9 in the morning and discharged at 3 in the afternoon. So with Doc Andrew working on it. So you can have more of Doc Andrew that way also. So that one, we are supported by expert cardiologists, the same caliber as Dr. Andrew, equipped with state-of-the-art diagnostics equipment because we were opened only last year and backed by a cardiac cath lab. Yes, yes. And our location, maybe you are familiar with that building. It's in Greenfield. So that's near the old EDSA Central. So that's there. There's no traffic there because it's just right beside EDSA. There's no parking problem because the building is owned and we have 3 basements for parking for you. Now, this is our reception. It's world-class because we made it to look like a hotel reception. There are no crowds. There are no long lines. So with an appointment and you get there, you get your treadmill stress right away because you don't have to wait. And your doctor, by appointment, unlike hospitals, you don't have to wait also. Yeah. Consultation room, so it's very spacious and comfortable. Cath lab, so we've had several patients already with Dr. Andrew also doing the procedure. Then there's state-of-the-art equipment for that, and our recovery room. That means you're discharged before evening, you are discharged already. So that's it. That's all I have to say. Come visit our clinic and see more of Dr. Andrew. And sir, on the sleep, if you are interested, Unilab has a division called Sleep Science. I don't know if you've heard of it. They have a sleep laboratory. Maybe they can help you. Unilab. So I can give you the contact number. Maybe there is a way. They have a laboratory for that.
Ma'am, excuse me.
Okay.
Can you give us an idea of the range of the cost?
The range of the cost, let's compare St. Luke's BGC to the Echo. St. Luke's BGC to the Echo is 9,000. In ours, it's only 5,000. Then less 20% discount of senior. So that's the difference. You get the same expertise of hospital staff and equipment, but in a clinic setting and a much lower price. There.
Do you also do general checkup?
Yes.
What we get, let's say, as a package in Makati Med or St. Luke's?
ECU checkup, yes. We
You
do
know,
that.
That's a one-night stay, no, overnight stay in the hospital. Do you
well,
do that? No.
I have a list. I'm not sure what you are looking for or what you need, but we do have packages of, let's say, hypertension package, if it depends. We have ECU, but not overnight. We're outpatients, so we don't have overnight stay in packages.
How about prostate and
Maybe that would be for the ambulatory
I
services.
did finish it. And ED. ED problems.
Blood pressure, maybe, yes. Maybe we have an ambulatory ambulatory service center, surgical center. Maybe those, sir, they're covered naman. They have colonoscopy. Maybe that one also, they might have it. I can tell them to call you to give you a list of what they have. Yes.
Thank you.
Thank you.
So
Thank you.
Thank you.
I think the cure for ED there is have beautiful, sexy attendants and nurses.
Come visit our clinic.
Okay, thank you. Thank you, Andrew. Let's give him a round of applause again.
Bakit
Okay,
ikaw
I'd now
pinadalita
like
dyan?
to call
Dapat
our Vice President Howie give our response.
Thank you, Eddie. Thank you, Andrew. And again, on behalf of the Rotary Club of Makati, thank you, Doc Andrew. And after the very nice talk and the very lively question and answer, I think I should change my job as the secretary of Andrew and take your appointments already. No? So I think most of the questions parang personal appointment. So I think most of us will now go to Andrew. No? So I guess what was important and what was nice to hear in the discussion of Andrew is that high blood pressure or cardiovascular disease can be treated. No, it can be avoided. So let us live a healthy life. And sa ating mga members dyan, sabi naman ni Doc Andrew, it is okay to drink in moderation, di ba? So that is one very nice thing. At again, to add to President Louis and to his mini socials of the ED committee, it is also very clear that Doc Andrew also said sex is good, di ba? But I should remind President Louis, next Governor Louis, sex is only good with antes. Di ba? So again, thank you, President. Balikan lang eh, di ba? So thank you again, and before we let President our speaker go, yung doon na lang sa diet, I would just add a little tips on the diet. Can I add a push diet? Yeah, push. Whenever you are seated in the dinner table, you push away. Di ba? And make sure that you have everything that you eat, di ba? Fishes on the water, di ba? And vegetable. Make sure your cows and pigs eat vegetables and teach them how to swim. Okay? So we take care of our heart. And to Ann Maida, I'm sure the heart is very, very well taken care of. That's why Andrew has a very happy heart, so that the Rotary Club also is given a happy heart and a healthy heart for all of us. So keep healthy, everybody. Okay, so we'll have, of course, our wine for our speaker, Andrew, and yung, oh, sige. We will give the others to follow. Okay, so thank you, Andrew.
Okay, VP Howie, if you can adjourn the meeting.
Okay, meeting adjourned.